I'm going to talk to you about urinary tract infections and the use of antibiotics when a patient has a catheter. First, let's talk just a bit about catheters and the infections that can occur. Using a urinary catheter increases the risk of bladder infections because bacteria can enter the urinary tract through the catheter. Seems pretty obvious, even around the catheter. Having a catheter can lead to the condition called catheter-associated urinary tract infection, and it actually has a mnemonic. It's C-A-U-T-I, CAUTI. So, the infection can happen in any part of the urinary tract, kidneys, ureters, bladder, or the urethra. Sometimes it can even cause septicemia in our hospice patients who are very depleted and often immunocompromised, and it can lead to death. Often families, they want to know when we're going to get a UA, and even a culture in sensitivity so the patient can be treated with an antibiotic. And you probably know that once a catheter has been inserted, bacteria can enter such that within 24 hours it is colonized with bacteria. And of course, the longer a catheter is in place, the higher the risk of developing a CAUTI. Here are a few things that can lead to an increased risk of infection. If there's no cleaning or improper instruction on cleaning the catheter and the surrounding area of the catheter daily, and especially after bowel movements. If the drainage bag isn't emptied frequently, or else they pick it up and allows urine to flow back into the bladder. So we want to always keep it below the level of the bladder. We've got so many videos on how to actually provide good catheter care. So watch all of the other catheter care videos. So now, how do you know if a patient actually has an infection? Let's talk about the symptoms. There can be discomfort or pain in the lower abdomen, pain or burning, a sensation around the catheter, foul smelling urine, cloudy or discolored urine, blood in the urine, fever and chills. And one of the most common symptoms in our older patients related to a UTI is just confusion or disorientation. They just start acting differently than usual. So what do we do for a hospice patient that looks like they might have an infection and they have a catheter? First of all, hopefully you have discussed with the patient and the family their likelihood of wanting to use antibiotics to be prescribed should an infection develop during hospice care. Generally in hospice care, we're not going to be doing tests to diagnose problems, so often an infection with a catheter is diagnosed based on the symptoms that we discussed. In our experience, oftentimes when there's a clear picture of a urinary tract infection with a catheter, we'll speak to the medical provider and consider prescribing antibiotics, maybe once or twice during hospice, but generally the decision to treat is based on whether the patient is actually having untoward symptoms. If the urine's cloudy, there's a bit of blood, strong odor, but the patient is fully and completely at peace and comfortable, then we do not treat the infection. Oftentimes families are uncomfortable with this decision, so make sure this is fully discussed before the catheter is placed, and again, if there's any untoward symptoms or discomfort. Of course, one more thing to say about use of catheters in hospice care. Make sure before you even put one in, are you choosing to insert it for a good reason? And limit the use if all possible. If the patient has retention or an extreme wound, or there's just family who cannot provide incontinence care easily, those are reasons to consider it, but it should not be used just for convenience. So to recap regarding infections with urinary catheterization, insert the catheter only when absolutely necessary. Teach appropriate and thorough daily catheter care. Be proactive and discuss with the patient and family whether antibiotics will be desired should an infection show up. Let them know the diagnostic tests may not be performed if there are signs of an infection in the urine with or without symptoms. Consider the use of an antibiotic when the patient is symptomatic after discussion with the medical provider, patient, and family. Hope that helps. Please get our booklet, the Hospice Care Plan. Watch all our videos at the Hospice Care Plan on YouTube. And remember our motto, care is treatment.